Vitamin B6 is perhaps one of the most overlooked keystones in mental health and emotional regulation. Its role in neurotransmitter production is not just important, it's absolutely crucial. In its active form, paradoxal 5-foot phosphate (PLP), B6 acts as a coenzyme in the biosynthesis of several of the brain's most essential chemical messengers: serotonin, dopamine, gamma-aminobutyric acid, GABA, and melatonin. These neurotransmitters govern mood, motivation, sleep, stress response, and overall emotional balance. When B6 is insufficient, the neurological consequences can be profound, subtle at first, but cumulative over time. Let's break this down further. PLP is required to convert the amino acid tryptophan into serotonin, the neurotransmitter most closely associated with feelings of well-being and emotional stability. Without B6, this conversion is hindered, leading to reduced serotonin availability in the brain. This isn't a fringe effect, it's a foundational biochemical reality. The modern epidemic of depression, anxiety, irritability, and even aggressive behavior may not always be rooted in trauma or external stress alone. In many cases, it's biochemical imbalance driven by silent nutrient depletion. Similarly, B6 is essential in the transformation of the amino acid glutamate, an excitatory neurotransmitter, into GABA, the brain's primary inhibitory or calming neurotransmitter. This single conversion helps regulate overexcitation in the nervous system, acting as a biological brake pedal. If this process falters, people can experience racing thoughts, panic, insomnia, irritability, and even seizures in extreme cases. It's no exaggeration to say that a B6 deficiency can destabilize the brain's most basic emotional control systems, often without ever being identified as the culprit. What makes this even more alarming is how few conventional treatments address B6 status. In psychiatry, the default response to mood or anxiety disorders is typically pharmaceutical: SSRIs for serotonin, benzodiazepines for GABA, stimulants for dopamine. Yet all of these pathways depend upstream on adequate B6 levels. It's not that medication is always wrong, it's that the foundation may be missing. Treating the end point of a broken pathway while ignoring its nutritional origins is like trying to patch a leaky roof without fixing the hole. Sleep, too, is deeply tied to B6. Melatonin, the hormone responsible for regulating circadian rhythm and sleep quality, is synthesized from serotonin, and again, this requires PLP. People with trouble falling or staying asleep who rely on melatonin supplements might never realize that their issue isn't low melatonin. It's a bottleneck in serotonin conversion, possibly rooted in low B6. And given how many things deplete B6, from stress and alcohol to hormonal contraceptives and blood sugar imbalances, it's not hard to see why this deficiency can slip under the radar. Yet in medical practice, B6 testing is rarely ordered unless there's neuropathy or obvious deficiency, and even then, the form of B6 assessed or supplemented may be suboptimal. Pyridoxine, the standard synthetic form, must be activated in the liver. But those with impaired liver function, chronic inflammation, or certain genetic variants may struggle with this conversion. This is why supplementing with PLP directly can be a more effective strategy, especially for those already dealing with neurological or psychological symptoms. Unfortunately, even this knowledge is not widespread in most medical education. In the world of functional and integrative medicine, practitioners increasingly recognize the role of B6 in conditions ranging from ADHD and PMS to anxiety and chronic fatigue. But this awareness hasn't made its way into mainstream guidelines, insurance protocols, or most general medical practices. And so, many patients continue to suffer, not from a lack of treatment options, but from a lack of foundational nutritional support. Perhaps the most frustrating part of the story is how inexpensive and low-risk B6 supplementation can be. Unlike prescription drugs, B6 is widely available, well tolerated in appropriate doses, and easy to integrate into diet or supplementation routines. Food sources like poultry, fish, bananas, potatoes, and fortified grains contain some B6, but stress, cooking, and poor gut health can reduce absorption. Many modern diets, especially ultra-processed ones, fall short in supplying consistent, bioavailable amounts. Meanwhile, lifestyle factors that increase demand for B6, like chronic stress, environmental toxins, sugar consumption, or alcohol use, are at all-time highs. So why is B6 so persistently ignored? The answer is likely systemic. It's unglamorous, unpatentable, and doesn't generate profit in the same way pharmaceuticals do. It's also difficult to promote because deficiencies can be chronic and subclinical, developing slowly and presenting vaguely: fatigue, insomnia, irritability, brain fog. Symptoms often dismissed or misdiagnosed. There's no dramatic scurvy or rickets-like disease state to draw public attention, so B6 quietly slips through the cracks of clinical awareness. But the science is clear. Without enough B6, your brain cannot make the very neurotransmitters that regulate thought, emotion, and sleep. You cannot convert tryptophan to serotonin or glutamate to GABA. You cannot produce melatonin efficiently. And you cannot repair the mental and emotional effects of chronic stress. The next time someone is struggling with mood disorders, insomnia, or anxiety, it's not enough to ask about their stress levels or prescribe a medication. We should also be asking, are they getting enough vitamin B6? Because until that question is answered, any treatment risks being incomplete at best, and at worst, a lifelong detour around a solvable nutritional deficiency.